Suppose you're reading a book or just generally words on a page like you see here at the top left of the screen. As you're going across line by line, word by word, each word that you're looking at should be in focus unless there's something, of course, wrong. And so take, for example, this word possible right here. As you're looking at this word, it is in focus, and it might seem trivial, but the reason for that is because each of your eyeballs, left and right, the gaze of each one is focused directly on the same point. The point being this word. And as long as the gaze of the left eye and the gaze of the right eye are focused on the exact same point, then whatever you're looking at, whether it's a word or an object, is clear. But what happens when there's a mismatch between the gaze of the left eye and the gaze of the right eye? Well, you end up with a situation potentially like this. So if you look here, this is a little bit exaggerated, but just to prove the point. So here the left eye is focused on this point right here. But for whatever reason, the right eye is not able to focus on the exact same point. And so now there's a mismatch between the focus of each eye, and what you're looking at is no longer clear. And one example of a condition that causes this mismatch between the eyeballs and result in blurring of what you're seeing is strabismus. Now, generally speaking, strabismus is any of these conditions here that results in the eyes not lining up with each other. And it generally manifests in one of these four ways. So in each of these examples, notice that the right eye is normal. There's no issue with the right eye, but the left eye does not line up with the right. The left one is abnormal in all four of these cases. The first type of strabismus is esotropia, in which one of the eyeballs is pointed too far inward, or it's too adducted. This could be due to weakness of the lateral rectus muscle. You have to imagine the lateral rectus muscle and the medial rectus muscle are kind of in a tug of war with one another. If the lateral rectus muscle is weak, then the medial rectus muscle by default wins, and so it's going to cause that eyeball to rotate too far inward. Okay? The next type is exotropia, which is the opposite. The eye over here is rotated too far outward, or it's too abducted. This could be due to weakness of the medial rectus muscle. Then we have hypertropia, which is where one of the eyeballs is rotated too far upward, which could be due to weakness of the inferior rectus muscle. And then hypertropia, where one of the eyeballs is rotated too far downward, which could be due to weakness of the superior rectus muscle. And as you could probably guess, strabismus is pretty obvious. You don't need to run any special tests. It's more just about observation. But something a little more subtle where you're going to have to run a special test is when somebody presents with central vestibular signs and they have impaired convergence. So convergence is this phenomenon when you bring something close to your eyes or close to your nose and you're focused on it, the eyes should rotate inward. They should adduct. Basically, the person goes cross-eyed. And we bring this thing closer and closer to the person's nose, and their eyes go further and further in. But there's going to come a point at which the person's going to be unable to bring their eyes any more in, and as a result of that, this object is going to blur. That point where this object blurs is called the near point of convergence. And basically, you just take a measurement from the person's nose to this object. And normally, that near point of convergence should be less than or equal to 10 centimeters, which is approximately 4 inches. So if it goes blurry around 9 centimeters, that's normal convergence. But if it goes blurry around 12 or 14 centimeters, that would be impaired or abnormal convergence. And so for that, we might want to treat it. And so for that, we're going to look at pencil push-ups. The first indication for these would be an impaired near point of convergence. Remember, the near point of convergence has a normal value of less than or equal to 10 centimeters or 4 inches. Those two are not exactly the same, but they're pretty darn close. Somebody that has an impaired near point of convergence is probably also going to have other central vestibular signs, like abnormal VOR cancellation test, abnormal saccadic eye movement, abnormal smooth pursuit. Those are all components of the oculomotor exam. And examples of conditions where you might see those might be a concussion, any kind of traumatic brain injury. Multiple sclerosis would be another example that attacks the central nervous system, especially the brain. And then the second indication for pencil push-ups would be strabismus. Now, an important point here. Pencil push-ups are by no means a cure for strabismus. If you see somebody with strabismus, you're not just going to give them pencil push-ups. They're going to need medical treatment to correct the strabismus. Okay? And even then, in-office vision therapy is superior to pencil push-ups. However, sometimes pencil push-ups will be a component of the treatment. They are not a cure for strabismus, but sometimes they might be included in the plan of care for somebody who has a medical procedure to correct the strabismus. But know that the current evidence suggests that in-office vision therapy is superior to the pencil push-ups. Okay? So how do you do pencil push-ups? The patient's going to be seated, and they're going to position the tip of a pen or pencil approximately 50 centimeters from their eyes. Are you going to get out a tape measure and measure this? No. But know that 50 centimeters is approximately arm length in most people, like you see here. Then they're going to slowly move that pen toward their nose along the midline, using maximum effort of the eyes to keep their gaze fixated on the pen tip and no diplopia, so no double vision. So the goal here is to be able to get this pen as close as possible to your nose without double vision. And the way that you get it as close as possible without double vision is by focusing on strongly drawing their eyeballs inward, ocular adduction. And then the movement of the pen toward the nose is stopped when, even at maximum effort to keep gaze fixated on the pen tip, diplopia occurs. So maybe right here, even though I'm using maximum effort to keep my eyes adducted, the pen tip becomes blurry. That's where I stop this. And then at this point, the pen is moved in the opposite direction, slowly back out to approximately 50 centimeters. Basically, the starting point. Again, keeping your gaze fixated on the pen. That constitutes one repetition. And so after that, the patient can blink, they can look away, do whatever they need to do in order to reset their eyes for the next repetition. So again, once they've reset, they're going to slowly move the pen toward their nose, maximum effort to keep their gaze fixated on the pen tip with no double vision. But then there's that point when double vision occurs, and then you move the pen slowly in the opposite direction, back out to arm's length. And that is a pencil push-up. Thanks for tuning in. Please like, subscribe, and check out my Instagram for cool science and not science stuff.